I don't wear masks when I go to a place. And today was the first time that somebody asked me to put on a mask. I went into Publix to get some popcorn chicken. And the lady at the door, she's like, "Excuse me, sir, your mask." And this was the first time ever. So I pull out this net. This is a beard net, actually. I put on this net and put it on my face, and she was fine with that. So the mandatory mask law has nothing to do with safety and has everything to do with compliance.
A sada, na primjer, treba da nosimo maske I rukavice, pa baš nam je drago I treba da znamo.
I ne treba da nosiš ništa. Ti lično.
Dobro, hvala lepo.
Hello, I am Dr. Ravi, and I'm one of the doctors, and this is Sam, our team leader. Hello. In this hospital, and this is Nicola, who is a trainer and fit tester for qualified masks. And I got a few masks here. She's going to explain what they are of any use. How about this, Nicola? What are these?
So these masks are just normal surgical masks which surgeons use in theater. They don't protect them from TB or corona, just protect them from splashes of blood.
Is this what they normally use in the theaters?
Yeah.
Yeah, so we'll use these for the circulators normally and for small cases. So not for open major surgery. These are for small cases, and the circulators around the outside will use them. There's one type that's just plain on both sides, and there's another type which has a slight band which will press against the nose. But they both do the same thing.
I'm going to pinch.
Yeah?
I'm going to stay there.
Yeah.
So will it give protection against corona?
No, it
No.
won't.
What's the percentage you would say?
I'll say 0%.
0%. So no good. These masks are no good.
No
Let's put
good.
them away. This one has got a visor. Mask with a visor. So what about this?
So this we use in theatre for surgeons for surgery. Obviously you've got the mask to protect you from the droplets of
Let me
blood,
wear
and then you've got the visor to stop the
Protect
spread.
your eyes.
Let me try this.
Protect your eyes.
It's
Yeah.
just for the splashes. It's not going to stop the virus going through.
No.
So what did you say the percentage of protection against corona?
Still 0.
Up to 0%.
Yeah.
So no good.
No good.
What does science say about face masks and whether or not they prevent the spread of viruses like COVID-19? Believe it or not, there have been a number of studies that have been done over the past decade. One in 2009, 2010, 2012, 2016, 2017, 2019, and yes, even this year in 2020. A number of controlled studies have been done that look at this very issue, whether or not wearing medical face masks with N95 respirators in them, and whether or not wearing cloth masks actually reduce the risk of a virus. So what did each of these studies find? Well, actually, they all found the very same thing. Now, these were studies that looked at N95 respirator masks. That's not the same thing as just hanging a piece of cloth over your face or creating your own mask at home. For the study in 2019, among 2,862 randomized participants, 2,371 completed the study and accounted for 5,180 HCW healthcare workers' seasons. Among outpatient healthcare personnel, N95 respirators versus medical masks as worn by participants in this trial resulted, get this, in no significant difference in the incidence of laboratory-confirmed influenza. By the way, just to be clear, in the 2009, 2010, 2012, 2016, and 2017 studies, they all found the very same thing as the 2019 and 2020 studies. Again, all of these are RTCs, randomized control tests, that are essentially set up to determine whether or not these N95 respirator masks help to prevent the spread of viruses in this setting. And all of these studies found that they do not. Statistically, they do not. We have been told that you must wear a face mask when you go out, and these N95 respirator masks are obviously the very best thing to wear, right? Which, as we're seeing, is not true, because those N95 respirator masks don't really protect you from transmitting and catching a virus. However, we're also being told that if you don't have an N95 respirator mask, which, by the way, the vast majority of people walking around in face masks do not have, they're not wearing N95 respirator masks. They're just wearing a cloth mask over their face. And what we've been told over and over is that if you just wear a cloth mask over your face, it's better than nothing, so you should do that. And so because of that, we have tens of millions of people walking around with cloth masks on their face. Now get this. In 2015, there was actually a study done taking a look at medical masks versus just a cloth mask and whether or not wearing a cloth mask would protect against the spread of a virus. And what that study found in 2015 should alarm you. Not only does wearing a cloth mask not prevent the spread of a virus, it actually can put you at greater risk for catching the virus. Look at this. According to researchers, this study is the first RCT of cloth masks, and the results caution against the use of cloth masks. This is an important finding to inform occupational health and safety. Moisture retention, reuse of cloth masks, and poor filtration may result in increased risk of infection. And this is very important information because we are hearing over and over from executives around the country, meaning governors and state leaders and mayors across the country, that you must wear a face mask to protect yourself and to protect others, and to not do so is an act of selfishness. And what they're telling you to do, according to these scientific studies, is to actually put yourself at greater risk. You're not protecting the population, you're actually putting yourself at risk. And by the way, even the biggest doctor of them all in this country, Dr. Anthony Fauci, who keeps talking about this issue, referred to wearing a face mask as mostly symbolic.